Good morning, everybody. My name is Steve Murray, and today we're talking, it's part 5 of a series that we're doing on the World Health Organization's physical activity guidelines, and doing a bit of a deep dive into some of the guidelines, and we're looking in particular chronic disease. So today I want to look at a condition that affects so many people. I think the numbers are up to, 1 in 3 adults at some point in their lives will experience this horrible condition, and that's cancer. So I want to look at exercise considerations in relation to this this horrible disease. So let's have a look at what we know. Absolutely well established data. The effects of exercise on outcomes, both in terms of prevention and in terms of the survival rate. So we know that physical activity, being active, having a cardiorespiratory fitness of at least 10 METs, or a physical exercise capacity of at least 10 METs, will give you some serious preventative ability against some very, very common, 7 of the really common cancers. And from a survival rate perspective, being fit, the really common cancers like breast cancer, colon cancer, prostate cancer, the survival rate increases significantly if you are active and you have a good physical exercise capacity. But in terms, so today I'm not really dealing with the prevention side of cancer, because we've done that before. I want to look really at people who are currently struggling with the condition and what does exercise do. So we know that physical activity, just being physically active during your treatment, has a significant effect on cancer-related fatigue. One of the major issues that cancer survivors struggle with, especially during treatment, is the fatigue related with treatment. So we know that being active at least 3 times a week, 30 to 60 minutes, moderate to vigorous activity, and 2 days of resistance training has a significant impact and improvement on cancer-related fatigue. And I know it's much like depression. It's a double-edged sword. The last thing you will feel like is to be active, after a bout of chemotherapy. But the data is really, really solid that's a good idea and will make you feel better. Health-related quality of life is also, without a doubt, improved. Also, with 2 to 3 times a week, 30 to 60 minutes of activity, also together with some resistance training, improves quality of life. I mean, quality of life is a major measure, and it's something that makes a big difference to people. And then obviously physical function. The ability to function in normal day-to-day life remains a vital component for anybody. And we know that we've got dose and effect there as well. The same thing, 3 times a week of 30 to 60 minutes of moderate to vigorous activity. Even though the producers of this infographic have said, look, there's insufficient evidence, we know that the evidence is really still really good, that being active improves anxiety and depression related, obviously, with having cancer. So this is the data that we know and has been widely published. I do want to, however, talk a little bit about some newer data that's out, which is quite exciting, with relation to much more, so physical activity not just being a nice to do during cancer treatment, but a must do. And this was a really exciting study that I read recently that looked at the mechanisms of physical activity during cancer treatment, or in the treatment and prevention of cancer. So we know that hypoxia, or lack of oxygen, that's one of the major triggers of tumor aggression, leading to the progression stage of cancer. And that's that's something you really want to try and avoid or slow down as best as you possibly can. So you want to avoid hypoxia. So, I mean, it goes without saying that having a cardiovascular fitness, in other words, having the ability to deliver oxygen to your working muscle cells, it will limit your chance of hypoxia. So the fitter you are, the less chance you have of being hypoxic or without oxygen. So that's, just a good idea. But more than that, so exercise decreases hypoxia, but it also reduces the bioavailability of some stuff that's nice for cancers. Cancers like this plasma lactate, which is a metabolite of anaerobic exercise. In other words, exercise without oxygen. So, having being active and being active frequently just reduces the chance of hypoxia, and also washes out this lactate, plasma lactate, from your cells, which is just a really good idea. And then further on in the study, it also the researchers are showing that there was a definite link between being physically active in combination with chemotherapy. So traditional treatment plus exercise reduces both progression of cancer and also the tumor volume. So simply the tumor doesn't get as big. And I mean, that has to be a good idea. And then finally, in what I want to just look at, pancreatic cancer is one of the most virulent and certainly one of the most fatal versions, of cancer. And the authors of the study showed that, excuse me, that exercise actually remodels the vascular structure, of the pancreas, even in very small doses. So prescribing physical activity at an established intensity and volume can be really, really decisive in combating the tumor microenvironment. And that's really what we want to do. So what the study is showing is that physical activity as a therapy, as a drug, together with traditional cancer treatments, produces more effective outcomes at the end of the day. I hope that was valuable. Please share this with anyone who might be struggling with cancer, friends, family, and have a good day. And we'll chat again tomorrow.